5 weeks after the botched healthcare.gov rollout, President Obama has apologized to the millions of Americans who are dropped from insurance plans that don't meet minimum requirements set by Obamacare. And I happen to be one of those millions of people. But will the president follow up on his apology and support a bill offered by House Republicans? Let's have a look and talk it out next.
Department of Health and Human Services Secretary Kathleen Sebelius sat before another congressional committee today, apologized for past mistakes, but looked forward.
People's lives depend on this. Too many hardworking people have been waiting for too long for the ability to obtain affordable health insurance.
The chairman of the Senate Finance Committee, a Democrat who was the lead author of the Affordable Care Act, voiced frustration with the flawed rollout of the healthcare.gov website.
When we asked for updates on the marketplaces, the responses we got were totally unsatisfactory. We heard multiple times that everything was on track, and we now know that was not the case. But that's in the past. Now it's time to move forward and figure out how to fix it.
Sebelius told senators from both sides of the aisle that the website is getting better every day. She said the fix can continue while the site is live and rejected the idea of shutting it down and starting over.
If we want to save families from going bankrupt, if we want to save the lives of more of our friends and neighbors by allowing them to detect medical issues early, if we want to keep prices down, delay is not an option.
Once again, the strongest criticism and opposition came from GOP lawmakers.
From where I sit, things do not seem to be going smoothly at all. In fact, I think we would all agree that thus far the implementation of the so-called Affordable Care Act has been an absolute debacle. Madam Secretary, while I'm glad that you are accepting responsibility for this disastrous rollout, I would have preferred that you and the rest of the administration were honest with us to begin with.
Dee Benke, Dr. Rosenberg, and Dr. Barr continue our discussions here on Fresh Outlook. Thanks for joining us. All right, well, we were talking about in the House. The Republicans are sponsoring a bill. We're going to see it hit the floor this week. That's expected to get a possible vote as early as the later part of this week. Basically requires insurers to keep offering current individual plans. Now, Republicans say they, of course, will give this their full support. But are we going to start to see that the Democrats are going to start splintering on this, especially with the 2014 elections coming up? Dr. Barr, you're right next, close to me, so we're going to start with you.
I think it depends on what's in this bill, but what I see with the Republicans is they want to destroy Obamacare. So I have to really take a look at what this is going to say. Delay, to me, as a psychologist, means destroy in this situation.
And of course, you've been a big supporter.
And I like Obamacare because it has a number of very fine features to it. It's certainly not perfect. Nothing's perfect when it comes to law. But it has a lot of good things like mental health, pre-existing conditions, extending kids on your coverage, many, many positive factors. And I see the Republicans really wanting to destroy this because of political reasons, not because of health care.
Now, I'm going to turn to Dee right now. We've been debating this for several weeks now. Dee, are we going to start to see the Democrats splinter on this?
I think so. I think they have to save their hides, basically, because it's very unpopular. People are now dealing with implementation that is a disaster. Not just the website, that's just a symptom of the disease. I mean, this is a terrible, terrible policy, and people don't like it. So you know what's happening? The constituency, 2 members of Congress, are like, look, you're out of here if you vote for it, you know, because Obama doesn't have to run again. But these folks do. So yeah, a lot of Democrats, especially in difficult districts, they're going to start bailing. They're going to have to, or they're going to lose.
Now, Dr. Rosenberg, I knew where these two individuals had on this issue, but
I don't know why you put me right in there.
That's why we gave you the middle seat.
Well, my short response is that all of this wouldn't have been a problem if the United States House and Senate had passed a single-payer bill. There would have been no sign-up. There would have been none of this business about different prices for different people. Everyone would have been guaranteed health insurance. It would have been a single payer. The reality was that the Republicans were not willing to do that, and the Democrats, most of them wanted, but they had to get to 60 votes. So what they did was they made a little bit of a deal with the devil, if you want to call it that. They had to pass a bill that they could get enough votes to pass something which was called health care reform. Not a perfect plan. But ultimately, what we're really talking about is a very small segment of the whole health care issue. Number one, only about 3% of the public is really trying to sign up on these websites. The reality is that many people can go into an office, they can sign up, and they're having no problems at all. It's the website that's the problem. And that's unfortunate because Obama has always been a very slick, technology-oriented campaigner and administrator. The second part is that the issue about the you can keep your own health care, that's a problem because he made that statement, but at the same time, they were inferior health care programs and they didn't meet a minimum standard.
If I could just make a comment to what Dr. Bill said, I like the public option also because in my practice, Medicare paid me 100% of the time I got paid. Insurance companies did not pay me and do not pay me. So I like the public option idea, and I think it's unfortunate that it never happened.
Well, let's talk about, there's no debate, I think, on this one, that this is going to be a great card for the Republicans to play on the way to the 2014 midterm elections. So my question is, if you're playing a Republican strategist, everybody gets to wear the hat of Republican strategist and then Democratic strategist.
That's pretty comfortable, actually.
Do you fault the constellations, higher premiums, and cutoffs between patients and their doctors? Where do you go if you're trying to win that Republican vote in 2014?
I don't think it's hard because there are so many problems, and I think that's why the Republican candidate for governor in Virginia almost won, because he kept pushing that Obamacare issue, and people don't like it. So I think, there are so many problems with it, especially the fact that members of Congress won't take it themselves. I mean, come on. If you want the law, the Democrats voted for the law, then you take the health care, and they're not. It's not right. It's not fair.
Dr. Rosenberg?
Well, I think there's certainly a lot of trepidation about how this is all going to play out. But really all we're seeing at this point is sign up for a program that you have to be signed up for by March 31st of next year. That's a long way off. That's 4 months away. And I think the reality is if the administration is able to straighten out these what appear to be sort of major snafus in a website and people are able to sign up, then I think a lot of this is all going to go away.
But it's interesting that you say, because in the media cycle just a little while ago, the Republicans were blamed for the shutdown. Now they're almost in a different kind of seat talking about...
Well, that's how politics plays out. But what I'm saying is that, every day is a new media cycle, okay? The bottom line, though, is if they're able to fix this sign-up portion, I think many people are actually going to be happy with what they have. But right now, this is not a good time for the Obama administration. I mean, I think they would have preferred that this never happened. I think there are a lot of people upset in the White House and in the administration, but they have to move on and they have to fix it.
Plus the fact he lied. I mean, the President of the United States lied about this. You can't say it. You're spinning it out of the way. The man said this was going to happen, and guess what? It didn't.
Well, I don't.
He said you would be able to keep your health care coverage.
Okay, well, guess what? A lot of people lost their health care
I'm one
coverage.
of those people.
Exactly.
I'm going to be dropped,
so it wasn't
and
true.
my rate is going to go up $200.
And people are not, they do not like to be lied to.
Well, I think in politics, again, we have to recognize, calling the president a liar is a pretty big statement to make.
But it's true.
Well, the question is, when he said it, did he understand that programs were going to be below a minimal threshold? I think that's the essential question. If he knew that when he was saying it, then I think he did mislead. If he didn't, then I wouldn't call that
Well, then
a
he's
lie.
inept. That's bad too.
Well, some of these policies are not what they should be.
Let's just go moving forward. Dr. Bart, you're the psychologist. A country obviously trying to come together, but we're moving forward right now, and we're looking at 2014 elections. The president obviously has to gain back some of the Americans back to his side. How does he go forward now?
Well, two things. I think that the president and the administration need to take charge of this. They need to get people to sign up. They need to make it work. And if it works in the next 3 to 4 or 5 months, that will play out very well for Democrats. As a Republican strategist, though, to answer your first question, I really think that what I would do is to take credit for the individual mandate. I would go along with health care. I'd make changes. And I would suggest to the GOP, come up with a plan. Come up with something that makes sense.
I think they have to come up with an alternative.
And they have not done that because they've only wanted to
I don't think so. Everybody wants what they had. People are like, look.
Well, I could tell you as a doctor.
No, I know you hate the insurance companies. We know where you're going.
We're going to have to come back and debate this later on. I'm being told that we're out of time, so they're telling me in my ear that we have to go to our next break. But it wasn't just healthcare that people were tweeting about this week. They were also talking about Twitter itself. To buy or not to buy, that is the question. We'll be right back to talk Twitter in our next debate.